James.
I'm up for that, James. If you all want to hear from someone different, there you go.
That's not having a go at you. Is this a good result?
Yes, it's not over yet. It's absolutely a good result. Everyone loves a day of zeros. But the incubation period is 14 days. There are literally thousands of people who've been potentially exposed to infectious cases. They need to see out their quarantine period. They need to not be complacent if they've got a negative test early on, because as I've said before, most people will be symptomatic, will test positive in the first week, but there are a proportion who might yet develop illness in the latter part of that quarantine period. There might be some people who still haven't checked the exposure sites, who've been exposed and aren't aware, who might be developing symptoms today, tomorrow, the next day. Everyone needs to be aware of that, and everyone needs to test if they've got any symptoms at all.
So presumably in agreeing to lift the lockdown, you're satisfied that any future cases in the next few days, you're confident will be already isolated?
I think so. The 66 close contacts per case is an indication that we've swept really broadly in picking up on those close contacts. No close contact left behind. So anyone who develops symptoms now, who test positive, you'd be very confident that they're already identified, already quarantining. That's not a guarantee. People need to do the right thing, and people do need to check those exposure sites to see if they are at risk.
Presumably the last 5 days have bought you time. What do you know about the virus now, the UK strain that you didn't know beforehand, that'll influence actions next time?
I think it reinforces that the three-ring principle of protection is the right way to go, and it can deal with variants of concern as well. There are circumstances where you need to pull out other tools, a short, sharp lockdown or a circuit breaker. But the contacts of contacts, in addition to the primary close contacts, I think can bring all of that risk under control through test, trace and isolate. If we weren't supremely confident in that process, the Grand Hyatt case, who had community exposures, might have led to a circuit breaker, but we didn't go that way. And that had happened before in other jurisdictions, but we didn't go that way because we did have significant confidence, well-founded confidence in test, trace and isolate. That said, there were specific challenges in the Holiday Inn outbreak with 2 residents, 4 staff essentially exposed, infected on the same day, and a social event that was not on our radar initially for various reasons. So that had specific challenges that meant that 4th ring of protection had to be in consideration. So we'll always use the tools that are required because we know that there's no alternative that we want other than getting to zero community transmission for that long-term, sustainable, open society that we need. But test, trace and isolate, I think, can deal with variants of concern if you go broadly, if you go really rapidly, if you get great response to testing and good compliance.
So does that mean that in this case the need for the 4th ring was as much to do with the fact that there was multiple transmissions at the same time rather than just being the UK strain?
There were different elements, but clearly, as Jeroen's pointed to, we had an explosion in the number of exposure sites. It got out to almost 40. Almost 10,000 people who are primary or secondary close contacts. When you've got that many people potentially exposed, you cannot afford to see cases pop up out of those exposed individuals who then have contacts with 20, 30, 40, 50 people. You need to make sure that if cases arise in those close contacts, that they only may be exposing their family or their household.
Therefore, what do you make of the Coburg situation where you did have contact in a very condensed room amongst multiple people, and we didn't see, with the UK strain, there was no nebuliser involved. How did that play out then when it's just on the back of that virus in terms of spreading exponentially amongst the community?
I mean, it was still a significant transmission event. It tells you that when you're inside, when you're in close contact, when people are talking and there for a time indoors, there are a number of people who can get exposed and develop illness. But if you can get ahead of it through those rings of control, because all of those, as soon as that transmission event was identified, all of those individuals were quarantined, they were tested, their close contacts were identified and so on. So that brought it under control, essentially, but it's not over yet.
Sorry, what's the 4th ring?
So the fourth ring is the circuit breaker as another protection. Yeah.
Reality is, though, that this cluster hasn't worked on the second one.
The great dilemma of public health and our great frustration is that when something doesn't happen, you get the accusation that you've done something that wasn't necessary. We don't know what might have happened in an alternative universe without all of the things that we have put into play here. But I'm sure the accusation would have been there that we should have gone earlier, or we should have done a circuit breaker if we'd seen cases emerge in these casual exposure sites or in these multiple locations where people were exposed. Masks have almost certainly stopped some transmission that would have occurred otherwise. The actions of people to test and to quarantine, knowing that they were at those exposure sites, I'm sure has made a difference.
So therefore, now that you've had, you say that you have to be cautious when you don't know what you're doing. Now you do have experience. The same action apply if you have a similar set of circumstances.
Oh,
Does the fact that you now have more evidence make you more cautious?
we'll always be cautious, but the confidence that we have in the performance metrics of test, trace and isolate are really reassuring. But every single circumstance on its merits. We will get cases where we've got this freedom of movement again, where someone will have been to an indoor setting with lots and lots of people, and it might have been, it might be a place where hundreds of strangers come into contact with them. That could be a profound challenge. So, we never rule out tools that need to be used if that's what's required to get to zero again. But I do think if it's a single case, if there are limited close contacts, that test, trace and isolate and those three rings can do the job the great majority of times.
Brett, do you believe you'll need the powers under a state of emergency for another 9 months?
Well, we know that the state of emergency allows me to have the power to quarantine people who are international arrivals. Without that state of emergency, there's no international arrivals into Victoria. So it's not to say that the state of emergency being in play means that there are public health directions that are broadly applied in lots and lots of areas of our lives. They will only be applied where they're required. But that's one key element that is clearly an ongoing requirement until we get that very substantial vaccination coverage.
The case you guys were more taking up about on Friday when you announced the lockdown was that Renetti's case in St. Regis. That case was a household member of a holiday worker, but they hadn't been told to isolate until Tuesday, 2 days after the first case at holiday. If you told all of the households of the workers of the holiday to isolate on Monday, as soon as you learned of that case late on Sunday, where
So we had an evolving situation where the first exposed individual who tested positive was an authorised officer. It was later that we understood when a resident turned positive, when there were other hotel, Holiday Inn workers who tested positive, that potentially every resident, potentially every worker in that setting was at risk. So we have to respond to the evolving epidemiology, which is exactly what we did.
Well, and I might also say that the Coburg event had already happened by then. So I think the answer is no. Although I think Chanel had one and she's been waiting very patiently. Oh, great, even better.
I'm hoping we don't see any more exposure sites. I certainly hope the testing numbers stay up for the next 9 days, indeed for the next several months, because it'll always be the case that people with any compatible symptoms need to come forward for testing. Something can always come out of the blue. That was New Zealand's experience this week. So if it's not for those individuals who say, oh, I'm not working in the hotel quarantine system, why should I get tested? There's no way I can have this virus. If it's not for those people going and getting tested at any point in time, that we wouldn't be able to track down these potential clusters and outbreaks. So absolutely hoping for zero cases, but if there are cases and they're in quarantine, they've been in quarantine right through, that's not a concern. But we do need people to continue that testing, especially for the next 9 days, to make sure that we're picking up anything that's emerging.
Brett, it's likely some people will be put out by the limit of 20 on outdoor gatherings while we're having spectating tennis.
So when you make a setting, private gathering, household gathering size, it's a setting for the entire population across 2+ million households. That's a lot of interactions, millions and millions of interactions. I know people make a comparison between their solo individual household experience, if you like, and an event taking place, but that event is a single day, albeit with thousands of people. But those private gathering limits, indoors and outdoors, are important just for this 9-day period. You know, next weekend we're hoping to be entirely different, but they do need to be in place because that is multiplied across the population.
I'm happy to. Rich will have more to say about exactly that matter soon. No, well, the first thing to do is to have systems that can speak to each other, and we've done that, and now we are quite close to making some further announcements about that. That'll make it an even better system. I would just take the opportunity to make the point that we have seen a few people. It's not everyone, and it's not a criticism as such, because I hope we can stop it from happening. But I just appeal to people: please write down your name and your phone number. Do that accurately. It takes just as long to write down numbers that aren't your real number. If you don't do that, it makes the job of contact tracers harder. It makes the spread of the disease easier, and it just isn't smart. So I just ask people, please do that check-in process. It's only a few moments, and if they're using pen and paper, or if you're typing in your number, please put down your number accurately. It's just the common sense thing to do.
Why were the local government areas inactive cases when released last night?
Sorry?
Why were the local government areas inactive cases when released late last night?
I'm not certain. We probably had a focus on many other matters, and we've released them as quickly as we could. Jerome, did you want to add to that?
So obviously with a large number of cases that we've been dealing with over the last 5-7 days or so.
Can you just explain the situation around 5 people at home that say 10 at the pub or 20 at the park? Why is that?
So certainly, again, across household settings, you're multiplying by every single household in Victoria, and so it is a cumulative risk. We know that transmission is particularly the case where people don't wear masks, where people are indoors, where they're in close contact, and when they're there together for a period of time. Clearly, household gatherings is that setting where the risk of transmission is higher. For a single household, it's tiny. Across millions of households, that's a cumulative risk that we don't want to be exponentially greater because the limits are 20 or 30 people. It's for this next 9 days. Certainly hope to make changes after that period of time. I hope people can have the patience to put up with it for that period of time, with a recognition that getting over this makes a difference to all of us.
Elective surgery will resume.
Let me come back to you. The employment figures, and also some modelling that some pretty respected firms have done in recent times, and you can sense it. Prior to Friday, things are coming back. I'm very pleased to see Victoria, looking forward with confidence. As challenging as these days have been, we'll get back to that rebuilding program, and we will because it's worked. And it's a great credit to the people of Victoria, who know what to do. They know that they love this to be over, but it's not, and we can't pretend that it is. And then we've got to make tough calls sometimes. But we'll have more to say about all of those matters. Support, obviously the budget in May, all of those matters will be dealt with at the appropriate time.
But you think this is confidence you refuse to rule out possible start lockdown if you necessary? Are you concerned about the impact that might have?
Well, look, Rachel, I don't think there's a premier in this country, to take your phrasing, that would rule out future lockdowns if they're advised that they are needed. I don't think anyone would do that. And if I'm being asked to do that, to rule out doing something that I'm told is necessary, I simply won't. That would not be responsible, and that would be quite different to what I offer. These are challenging times. This is not over, but that's why we all have to stick together and work hard and get this vaccine rolled out, help the Commonwealth do that important work. get those jabs into as many arms as we can, and that's why I again take this opportunity. You know, we're going to probably, whereas every day I talk to you about get tested if you've got symptoms, that remains the case. We're probably soon going to move to, you know, if you're approached to enrol in the vaccine program, if it's your time in the queue, you're ready to be given your jab, please go and do it. Please go and do it. The TGA approvals yesterday or the day before of AstraZeneca, yesterday I think, are among the highest thresholds, the most rigorous process anywhere in the world, and we need to get as many people vaccinated as fast as the supplies can be landed. Sorry, in relation to? Sure. Well, we'll have more to say about support. And I know that might seem quite a simple thing, but there's quite a bit to go into that. You've got to assess the impacts, and you've got to make the best decisions possible, and we will do that, and we'll make those announcements as soon as we can. You're about to ask me about a PIN notice of work cover, correct? WorkSafe. An AO. Sorry. I believe that Jerome has got a meeting with WorkSafe today, and we'll work through those issues. We believe that they've already been resolved in the main, if not all of them. But we'll just work through the normal process with that. Yeah, I think it's really important that we don't have a situation where any of us are anything other than focused on safety, and the occupational health and safety, WorkSafe as the often the arbiter of that, and the people who have principal responsibility for that. It's really very important. No decision's been made on that. It's too early for us to make that decision. Yep. Sure. Oh, well, you've got potential contributions from the private operator, you've got potential contributions from the Victorian Government on behalf of taxpayers, you've got contributions from those who freely, before they book their ticket, agree to pay the cost of quarantine, or at least some of them. That mix has not been settled. There's lots of different options, and there might even be a contribution from the Commonwealth Government, who have responsibility for these matters after all. Oh, we're always talking to people about these matters, and we'll update at the appropriate time.
I thought you forgot about it.
Well, of course, the TGA